In spite of spike in cases of COVID in Kerala, there is yet another virus called Nipah virus that is being reported in Kerala. In 2018, 17 people succumbed to death. In 2019, there was no fatalities. Now, there is the death of a 12-year-old child in Calicut that is reported in Kerala due to Nipah virus. So let's know what is Nipah virus, what are its causes and treatment. Nipah virus infection is a zoonotic illness that it causes severe diseases in both animals and human beings. Nipah virus is an RNA virus of family Paramyxovirus and genus Henipavirus. It was first detected in 1998 during an outbreak in Malaysia. The death rate of Nipah virus is very high. It is 74.5%. The natural host of this virus is fruit-eating bats. Nipah virus is not an airborne infection. It is caused by in contact with animals such as bats or pigs, or eating the contaminated foods that are bitten by these animals, or with contact with a person that has been affected with this disease. It is mainly spread by droplets. Now about treatment. There is no proper vaccine or drug effective for Nipah virus treatment. In Kerala, ribavirin and monoclonal antibody, that is to reduce the viral load and increase immunity, is used. The treatment that is given for Nipah virus is supportive treatment. In some cases, seizures can be noted. This virus migrates from the throat through the lungs and can cause pneumonia. It can migrate to blood and can cause viremia. And it can also affect the heart and can cause myocarditis. In severe cases, it causes encephalitis and unconsciousness. And ultimately, it leads to death. The incubation period of Nipah virus infection is 4 to 14 days. In some cases, it can be 21 days also. It's really important to differentiate whether the infection is caused by Nipah virus or coronavirus. So to differentiate between Nipah virus and coronavirus, we must know that Nipah virus is found in only certain countries like Malaysia, Bangladesh, India, etc. While coronavirus is spread all over the world, it is a global pandemic. The spread rate of Nipah virus is very less compared to that of coronavirus. Coronavirus can be spread from a person that shows less or no symptoms, while Nipah virus transmission is from a person who shows clear-cut symptoms. The death rate of Nipah virus is really high, above 70%, while that of coronavirus is relatively less. In Nipah virus, the person shows symptoms like severe headache, encephalitis, seizures, etc. Now let's learn about the diagnosis of Nipah virus. For diagnosis of Nipah virus, the cerebrospinal fluid of the patient is taken, or throat swab, urine, feces, or blood is taken, and RT-PCR or ELISA test is used to confirm whether the patient is affected with Nipah virus or not. Now about the preventive measures of Nipah virus. The precautions to be taken are similar to that of COVID virus. That is, wearing of mask, using gloves, using sanitizers, maintaining social distance, etc. Don't eat fruits that are having bitten marks on it. If you are looking after a patient that is affected with Nipah virus, wash your hands thoroughly, wear mask, gloves, etc. Maintain social distance with a person having those symptoms. In Kerala, there is a presence of fruit-eating bats. So this virus particles enters from the bats to this fruit, and it remains viable for some days. So when a person eats this fruit, this virus particles enter into the human being and he becomes affected. And through its droplets, the disease can spread through other human beings also. If a person is affected with Nipah virus, contact tracing, isolation and treatment are given to the patient. So there is no need to be afraid, but be cautious and avoid unnecessary panic. And follow all the guidelines laid by the government of India. Thank you for watching. For more health related videos, do subscribe this channel.